into it's okay. I don't know if you prefer to talk in English or Arabic. يا تفضلوا بالعربي لو بالإنجليزي. I need somebody to tell me نفضل بالعربي لو نفضل بالإنجليزي.
Guys, you can
Both
leave
are
a comment.
perfectly fine.
نعم.
Both of them are perfectly fine.
Okay. My name is Fadhil Hussain. I'm طبيب قلب. I'm a cardiologist here in the US. We left Iraq back in 1979. I was only 14 years old. I used to be in Baghdad College. I was in the same same class as Uday ibn Saddam Hussein. We were in the same year. We left in 79 and I finished my high school in England. And I came to the United States when I was 17 years old and I started my college and medical school here. So I finished and I don't know if you folks are familiar with the United States. The United States doesn't have a 6-year medical school. We have to do a 4-year undergraduate and a 4-year medical school. By the way, if anybody wants to ask a question, feel free to interrupt me. Don't be afraid. Just go ahead and interrupt. So I'm sorry.
You're fine. Can you just share the slides so we can look at it when you're presenting?
Live. Well, how do I hit it? How do I show it?
If you're a host of the Zoom meeting, you can share it, or somebody from the organization can share it.
If somebody from the organization could share it, that would be awesome.
Yeah.
Is Noor in the group?
I can try to share it. Sure. Yes.
Go ahead. So share it. And by the way, the presentation I'm giving you, I'm going to expand on it. So I'm not just going to stick to the presentation, and I'm going to elaborate things about it. Okay. That's it. Oh, she shared the different one. I sent her another one. I sent her an updated one. Noor.
Yeah, 1 second. Let me just grab that 1 second.
Okay. Because I changed few things.
Okay, can you see it now?
Yeah, I could see it.
Okay, perfect.
So I'm going to let you advance it. So as I'm talking, somebody will hopefully advance it. So I did my undergraduate in biology and in endocrinology at Kent State and Case Western Reserve. Then I went to medical school at Wright State University. That was back in '87. Graduated in '91. Wanted to do a residency in the East Coast of the United States and went to University of Connecticut for 3 years, did my residency. I didn't like the East Coast much, so I came back to Cleveland where the hub of cardiology is. All the research, most of the research that is done in the United States is done really in Cleveland. And so I came and I joined Case Western Reserve for 3 years to do my fellowship. I specialized in diagnostic invasive cardiology. So I'm not an interventionalist. I don't put stents in. I don't do structural cardiology, but I do cardiac catheterizations. I do transesophageal echoes. I do pericardial centesis. I do invasive testing, but I'm not an interventionalist. I concentrated on imaging. I did a whole year of echocardiography at Case Western Reserve, and I was recruited to Toledo to work in a big group as a general cardiologist. I'm not going to talk about the cardiovascular specialty lifestyle until the end of the presentation, because I need to go through the things that cardiologists do, and then come back and talk about the lifestyle. When I came to Toledo, in the Toledo area, I joined a very big group that super specialized, and I didn't like that approach. I liked the more customized approach to medicine, where you sit down with the patient, where you know the patient very well before you do the procedures, and I started my own practice. At one point, we were 4 people, and we were doing very well. We still are. The reason I chose cardiology, I understand your group is a surgery focused group, so I'm not going to try to make fun of surgeons. I love surgeons. Cardiology is a perfect specialty where somebody could combine medicine, combine diagnostic skills, combine clinical investigation, and procedures. So if you really like procedures, you could do procedures all day long in cardiology. There's now specialties called structural cardiology, where you could do aortic valve replacement, mitral valve clipping, mitral valve replacement. They talk about putting Watchman, and we'll go over everything. So if you like to do procedures and not do any diagnostic investigative work, you could do it in cardiology. If you want to become just a pure diagnostician, general cardiologist without any invasive workup, you could do it, and you could be just as successful. So cardiology to me was the perfect mixture of both, using your hands, doing procedures, and being an investigative workup. And the reason I chose the invasive diagnostic, not interventional, because I really didn't want to get up at 2 o'clock in the morning to go and do an intervention on somebody who's having an MI. I could schedule my own procedures at my own time without having to be up all night. So that's a little bit of a selfish reason. In my practice, I have a general practice. The number one, you could go to the next slide. Okay, so in my practice, the disease conditions, the most common disease condition that I deal with is coronary artery disease, and it's at the bottom of the list. It's at the bottom of the list because it is the most boring of all the diseases that I deal with. It's very easy. Somebody has a blocked artery and they have coronary artery disease, and you have to treat it. It's a cookbook. And the most exciting to me is heart failure, because heart failure is a condition that so many different diseases could cause it, and so many different diseases could contribute to heart failure. I'll give you a perfect example, a simple example, and then I'll move in quickly through this. Just 2 weeks ago, a pregnant young lady came in with congestive heart failure, and she was giving diuretics, she was giving treatment, and 2 other groups of cardiologists were working on her, and they couldn't figure out why. She came into my practice as a second opinion, and the reason she was in heart failure because she had iron deficiency anemia. It was very simple. I transfused her with iron. Within 3 days, she did not need diuretics anymore, and her heart failure completely resolved. So something as specialized as heart failure, where everybody says, oh my gosh, you have a weak heart, you have this, you have that. And her only problem is that she was anemic. So I like heart failure because heart failure allows me to use my brain. I do a lot of invasive diagnostic testing for heart failure when valve disease is involved, and I get to evaluate the entire body when it comes to heart failure. So I put down heart failure first, simply because there are so many organs in the body that cause heart failure. And for a good diagnostician, you need to take a look at everything, and heart failure is my favorite. Coronary syncope is another. We have a lot of young people who pass out, and there are many reasons for it. Ischemic sequelae of heart disease, valve dysfunction, cardiomyopathy, whether it is drug-induced or alcohol-induced or familial cardiomyopathy, hypertension, arrhythmia, valve disease. All of these are diseases that I take care of and handle, and it involves non-invasive testing as well as invasive testing. So if you to evaluate the valves, to treat the valves, we do a lot of invasive work, and to treat it, we use a lot of medications. So that takes me to the next slide. The next slide. So what do I do? My office, I have a nuclear camera for stress testing. I have an echo machine to do echocardiography. We have the EKGs. We have pacemaker interrogators in the office. We do a lot of non-invasive testing in my office. Invasive testing in the hospital. I do a lot of cardiac catheterizations during the week, either to evaluate for coronary artery disease, or to evaluate for valvular disease, or to evaluate cardiomyopathy, or to evaluate pulmonary hypertension. We do a lot of transesophageal echoes in the hospitals. And again, those are primarily to evaluate valvular disease. Pacemaker placement, defibrillator placement, cardioversions, getting people out of AFib and atrial flutter on an average 3 a day. Interventional cardiovascular procedure. I'm not an interventionalist, so I work with interventionalists, and interventionalists nowadays are divided into two kind of interventionalists, either structural cardiology interventionalists or interventional, all traditional interventionalists. The old traditional interventionalists work primarily on vascular disease. You put a stent in an occluded artery and you open it up, and you help somebody who's having a heart attack. The structural cardiologist is something very new, very fresh, and very exciting. And that's where cardiology really is encroaching on surgical specialty. In the United States, we're doing a lot of percutaneous aortic valve replacement, percutaneous repair of mitral valve regurgitation, percutaneous of repair of tricuspid valve. There's a lot of research, a lot of new valves that are being designed for to place percutaneously in the mitral valve. So structural cardiology is really, really exciting. This is if you are interested in surgery, and if you're interested in procedure, I shouldn't say surgery. If you're interested in procedures, but you still want to have a lot of diagnostic skills and thinking and evaluation of patients with valvular disease or cardiomyopathies or hypertrophic cardiomyopathies, structural cardiology is an awesome area, an awesome arena where everybody's going into. The next slide. There's a lot of so that leads me from the structural cardiology to the next slide, which is valvular repair and valvular replacement percutaneously. A lot of research is going there. Nowadays, I was talking to one of my colleagues at the Cleveland Clinic. They are suturing the mitral valvular annulus to get the mitral valvular annulus smaller, to resolve mitral regurg without opening the heart. I mean, something that is incredible, and cardiologists are doing that now. But that's research. These are the area of research where we could do mitral valve repair, mitral valve replacement without surgery, and just do it percutaneously. Stem cell implant, that's been going on for 20, 30 years, and I don't know where that is going. That had a lot of excitement for simple conditions of dilated cardiomyopathy and ischemic cardiomyopathy, where we inject cells into the coronary arteries to hope that the myocardium will regenerate itself. There was some limited success and there was some failure. The other places where research is really taking place right now is anticoagulation. In the old days, when somebody has coronary disease or have a heart attack, most of the time we concentrated on platelet inhibitors like clopidogrel with aspirin. Now the thinking is attacking the factors, the clotting factors, as well as the platelet inhibitors is where it should be. And there's a lot of research heading that way. Lipid management is very, very big. And I mentioned structural cardiology earlier. We talked about valvular repair and valvular replacement, but also structural cardiology is involved in sclerosing cardiomyopathy, and we're doing quite a bit of that. So now I'm going to go back to the lifestyle. I said I'm going to end it with the lifestyle after I explain myself. So the lifestyle for a general cardiology is very, it has a very wide spectrum. When I'm 58 years old. When I first came out of fellowship 27 years ago, I was very aggressive. I wanted to do everything. I wanted to take care of the heart attack. I wanted to take care of so my lifestyle stunk. I was up at 2, 3 o'clock in the morning. I had to run. I had to do things, and I was involved. And as I'm getting older, I don't want to do these things. There's nothing for me to prove. And I have become more and more of a diagnostician and less of an emergency cardiologist. So the lifestyle, you could have a very simple general cardiology lifestyle where you work in shifts 9 to 5 in the hospital or for a big group, and you never do any procedure, and you don't have to take call, and it's a 40-hour a week gig, and you will make a good, decent income, very good income. Or you could be very aggressive. You could become an interventionalist or a structural cardiologist where you're on call all the time and you put in 70, 80 hours a week. Right now, I'm more like 60 hours a week, not as bad as it used to be. And it's not quite the completely benign 40 hours a week where I just do 9 to 5 and that's it. So when we talk about my typical day, when we talk about my typical day, I have office every day. I start my office at 7:30 in the morning, and I'm in the office from 7:30 to 1:30 seeing patients. While I'm seeing patients are having stress tests and having images done in my office. After 1:30, I drive to the hospital. I do procedures in the afternoon, and after I'm done with the procedures, I round on the patients that are in the hospital, my patients who have had open heart surgeries, patients who have had intervention, or patients who are in for congestive heart failure. On an average, I do put in about 60 hours a week. I'm considered an extremely busy cardiologist in my town. I do about twice the volume of the average cardiologist in town. And alhamdulillah, I've established a very good reputation, and things are very good. So I hope that wasn't too short or too long of going over what I do as a cardiologist. If you guys have any questions, please, I'm going to open it up for more questions. This way, we have more time for questioning.
I'd say a general question I have is, what are some pieces of information or advice that you would give to maybe medical students in Iraq to apply to the US?
So the first thing, I mean, the most important thing is to make sure that you score very, very high in the board exam. There are 2 criteria that are important. One, in order to get into cardiology, you'll have to go into internal medicine. So the way it's done in the state, it's either surgical specialty or medical specialty. So cardiology is considered a medical specialty. The nice thing about medical specialty is that you really do not need the highest board score to get into internal medicine. Now, I said that, but that is the most important thing that that medicine residency look at is the board score. So if you are in the top 90th percentile, you could choose the program that you want to go to. The one thing that I really want you folks to concentrate is to study for the board. The programs here in this country, they don't know anything about about your medical school. They don't know how good or bad it is. They don't know what they teach you and they don't teach you. And the only thing they have in front of them that will evaluate them for you, evaluate you for them, is the board exam. So for a foreign medical graduate, the board exam is very, very important. Unfortunately, that is the least important if you are an American medical graduate, because the American Medical Graduate Board is now pass-fail. So I don't know if they still, I'm sure they still look at the score for a foreign medical graduate, but Noor could fill me in. I don't know whether they changed the board exam for the foreign medical graduate to pass-fail too. I don't know if they did that or not. So board exam is very important. And two, I have well, I about 7-8 years, it wasn't even 7-8 years ago, about 9 years ago, a graduate from University of Baghdad called. And his father asked me, his father is a physician, and asked me if he would shadow me. I said I'll be happy to for him to shadow me. He shadowed me for a month. I introduced him to the residency directors, and guess what? He is now a cardiothoracic surgeon. He did 5 years of surgical residency and 2 years of cardiothoracic residency. Until this day, every time, everywhere he goes, he thanks me for getting him started. So the next important thing for you guys is, besides the board exam, is that you find somebody that you could shadow and you could work with in the United States. That's a tough one to get, because you need to have a visa, you need to have this and that. But if you could shadow somebody here in the US and prove to them that you know what you're doing, then they will accommodate you and they will take you. The third thing is, never wait too long from graduating from medical school. So every single program in here have a 5-year limit. If you are 5 years out of your medical school, they will not accept you. They will not even look at the program. And I have seen them, the minute the application is more than 5 years from graduating from medical school, they'll throw it in the garbage, even if it's the best application.
That's an interesting to look at, but what
Don't
are
wait,
some, like,
don't
do
wait
you
more than
recommend
5 years.
anything?
I'm sorry?
Yeah. Do you recommend anything like we do during our 6 years, like, stay in medical school? Right now I'm like a second year medical student. Do you recommend anything we do during this like 6-year time period to maybe prepare, I guess, to go to the US? Because I'm a US citizen and I'm studying here in Iraq. I'm planning on like finishing the 6 years, basically skipping the whole, school or US college tuitions and how expensive it is. So I was thinking of finishing the 6 years here and then like applying to the US eventually after finishing the 6 years of general medicine here. So is there anything, any preparatory things that we have to do?
So for you, my biggest advice would be to ask them, is this a Mustansariya Medical School or is this Baghdad University? Who am I talking to?
My name's Amar Mohammed. I'm
I
from
know, but
the University of Fallujah.
Fallujah, okay. So you go to your University of Fallujah and you ask them, say, guys, would you let me go to the United States and do 6 months of my 6 months or 3 months out of my 6th year? You know how you do rotations on your 6th year? Spend some of your time in the United States. So if before you graduate from Mustansariya, from Fallujah, if you ask them to come here for 3 months where you do rotations here in the United States with some of the hospitals, with some of the medical school, to prove to them that you're good, that will be the best thing you could do.
Is that like a thing that can happen? Like they allow that?
Now that I'm going to ask you to explain to me, what do you guys do during your 5th and 6th year in the Baghdad? I finished from here, so I don't know the system very well in Iraq. But tell me, what do you guys do when do you start doing clinical work and less basic science?
I'm a second year student, but like from what I've heard, I think it like begins from the 3rd year, and like 4th, 5th, and 6th is more like hospital orientated medicine. It's not just standard lectures, and
Perfect.
it's more clinically orientated.
So from your 6th year, You could tell them that I want to do a month of surgery in this medical school in the United States, or I want to do a month of internal medicine in this hospital in the United States, or I want to do a month of infectious disease in the United States. So if you are a U.S. citizen, coming to the U.S. would be very easy. All you got to do is just ask your university, Fallujah Medical School, listen, guys, I need to do 3 months of my clinical rotations in the US. Would you allow me to do that? And I know for a fact they would.
That would be great. I mean, that would also help to like set a base in the US and build
Exactly.
something off of it. Just, instead of just staying in Iraq and,
Exactly.
staying in that
So you
environment.
said you're a US citizen. So where did you guys live in
Yes.
the US before you went to Iraq for school?
I stayed in Alabama for a bit, in Michigan,
Okay.
and then like the last thing I was in Washington.
Okay. So Michigan, I mean, Michigan has a ton of, if you're familiar with Michigan, Michigan
Yeah,
has
the University of Ann Arbor. It's amazing. My mother had the privilege of studying there.
Okay, well, University of Ann Arbor is going to be University of Michigan and Ann Arbor is going to be very hard to do rotation from outside. I mean, I'll tell you that. They are very hard. If you could get into University of Michigan for a month of rotation from a foreign medical school, that will be near impossible. But the reason I said Michigan, because Michigan has Henry Ford, has Beaumont, has Detroit Central. All of these hospitals are very, very open to the idea of accepting a foreign medical student to come and do rotation with them for the following reasons. These hospitals want to have the best interns and the best resident, but they are not as picky as University of Michigan and Ann Arbor. Ann Arbor, University of Michigan is considered the 6th best residency program in medicine. It's considered the 10th best in surgery. So when you are the 6th best in the United States and there's 3,000, they could pick and choose from their own people. They are snobby that way. But if you go to a residency program just an hour away from Michigan, you'll get just as good of a training, if not just the same training, but these hospitals don't have the pick that University of Michigan does. So for you, especially for you, if you are a U.S. citizen, I mean, my gosh, that will be the best thing you could do is to come to the United States during your 5th or your 6th year to do 3 or 4 months of rotations, clinical rotation. You ask your dean of college, says, listen, I want to spend, I have a month in internal medicine, or I have a month in the surgical rotation, or I have a month into ear, nose, and throat. I want to do them in the United States, and here are the hospital, or here's the program that is willing to sponsor me. Boom, you're done.
Have you seen anyone that's done this? Like anyone that came?
Oh yeah.
So it is like a possible thing.
When I was doing my residency at University of Connecticut, and I'll give you an example. University of Connecticut and Duke University have an agreement with a Pakistani university. Okay, the Pakistani university's name is called Aga Khan. And what they do is they used to send 12 of their students to University of Connecticut to do rotations so they could apply for residency at University of Connecticut. They did that with Duke. Even Duke is one of the best places.
One of the greatest colleges, yeah.
Yeah. So, but they still have a deal with Aga Khan where they send their students to Duke to do rotations to see if they're good or bad so they could take them to the residency program or not. So yes, I absolutely have seen that. If you're able, if your college, if your medical school allows you to do some of the rotations in other places, that will be your way in.
I'm just gonna add
That's
something
amazing.
here. I'm a medical student in the United States right now, and I'm really familiar with I'm gonna take my boards in a few months as well. So step one, it's made of 3 steps: step 1, step 2, and step 3. As Dr. Hussain said, the first boards exam is now pass fail, which is good and bad because you just need to pass, right? But you now need things like research, or as he's saying, like shadowing, like observerships, things like that, rotations. That's what's gonna set you apart. But I'm from Washington originally, and there's a lot of universities. University of Washington. I've lived in Alabama, University of Alabama, in Huntsville, Alabama. They have a lot of international medical graduates. You just go onto their website and you can apply to rotations. And since you're a US citizen, that should make it really easy for you. You just have to gain those experiences. If they see you're passionate about this and you're taking the time to make those connections and network, and rotate in certain specialties, especially I would say internal medicine. My own dad did that. He came from Iraq and he came here as an international graduate, and he got into internal medicine that way. So I know a lot of people who do that, and it's very possible. So for right now, I would say do research, get those experiences, and just make those connections. But yeah, I just wanted to add that in.
Thank you guys so much for your insight. Another thing, would it be possible if I maybe had a contact information from you guys, maybe even an email or something, because I still have a long road ahead of me, and like it would be great if I had like someone maybe I could ask advice from, because I don't really know a lot of people in the US or like Iraqis in the US, practicing medicine. I'd love to maybe, ask some questions, if it would be okay with you guys.
No, I mean, Noor, you have my email. You could share my email with them.
Yeah, I'll put your email in the chat.
No problem. Would that be good enough for you?
Yeah, anything. I mean,
Yeah, the email.
I
Yeah,
just like just
I have
anything,
no problem.
regarding.
I mean, I have no problem. Mustafa al-Baldawi is the name of the cardiovascular surgeon, and he and his dad till this day they call every day, and I tell Mustafa, and I'm going to tell you the same thing. I'm willing to help every Iraqi to come in here. Anybody. I mean, I left Iraq when I was 14 years old, and I'm willing to help anybody. My email is here, and if I can't help you, I'll send you to Mustafa Baldawi, and I say, Mustafa, remember when you promised me you'll have any Iraqi? This is Iraqi you could help. Well, and there are a lot of people in here that we could work with.
Thank you so much for the help. I mean,
no problem.
Thank you so much for the insight.
No problem. Anybody else? Any other questions? I see a lot of people have left already.
Hello, doctor.
Yes, ma'am.
Doctor, so you have mentioned that work in the office that you have. So is it like your private clinic? Because are you allowed to have a private business there, medicine in the US?
Yes, I am. Actually, it's I'm a dying breed. Not a lot of people are doing this anymore. So for example, in Toledo, there is 88 cardiologists, and I am absolutely the last independent private cardiologist in my own private office. Everybody else has joined, and they are employed by hospitals and employed by healthcare systems. They make a lot more money than the private doctors. Because they are paid salaries by the hospitals. But I refuse to be employed because I like to do things my way, and I have a private practice, private office. It's legal. You could do it. And alhamdulillah, I'm very blessed with having every who's who in town to come and see me. I've established a good reputation, and as a result, I am able to compete with my own practice. It's completely private practice.
Thanks, doctor.
I'm 100% private practice.
Yes, very inspiring.
Thank you. Welcome.
Good evening, doctor. Good evening, everyone.
Good evening.
Thank you for sharing your experience. It was an enrichment lesson. For my question is, there are a lot of doctors from Iraq that go abroad to US or UK, IMGs that want to continue their studies abroad. So my question is, as a doctor in US, in your opinion, what are the advantages of being a doctor in the US rather than the UK? Because I'm tempted between the UK and the US, and I haven't decided yet. Yeah.
I personally am biased, so I'm glad you brought the UK, and I'm gonna tell you I have experience of both. So I left Iraq when I was 14 years old. I went to the UK. I finished my high school in the UK, my O level and A level, and I finished them very young. I finished them when I was 16 years old, and I applied to medical school there. They said, "You're too young. You'll have to wait until you're 18 before you start medical school." And I was too antsy and I didn't want to wait, so I came to the US, and that's how I started. My parents live in the UK. The advantage of the US is that the US is more of a competitive field, but it is more fair way of getting into medicine. So let's take a look at me. There's no way I could have achieved or accomplished what I've accomplished in the UK, and I'll tell you why. I'm going to go through a very simple step, and I'll tell you why there's no way I would have achieved it. So in the UK, I applied to medical school. They said, you have to wait until you're 18, but I had my residency in the UK. If I was a foreign medical, if I didn't have my residency in the UK, they wouldn't have even looked at my application. But that's a different thing. So in here, when I came to the US, I did my undergraduate. I was a foreign student. I was on a visa student. I applied to medical schools. Medical schools in the United States are divided into two types. There is a state sponsored or a state school, like Ohio State, like Wright State University, where I went, like University of Cincinnati, and there are private schools. The private schools could be bad and they could be very good. So what is a good private school? A good private school is Harvard. A good private school is Case Western Reserve. And there are some bad private schools that is all about the money, but they're not very successful. So if you come to the United States, I finished my undergraduate and I was still a foreign student, a foreign visa student. When I applied to medical school, half the medical school sent me a letter and says, we would love to have you as a medical student, but we are a state medical school and we can't accept you because you're a foreign student. So let me tell you, back 1987, the difference between the tuition between a state school and a private school. A state school was $6,000 a year. This is back in 1987. A private school was $60,000 a year, was 10 times more. So when I applied as a foreign student, the Ohio State, University of Cincinnati, I mean, they called and apologized saying, we can't accept you because you're a foreign student and we are obligated to accepting just our own citizen. Wright State University is a state school. The dean called me up and he said, I cannot pass on you. You have such good records. You have such good exams. I want you to come in and interview with us. So I went and interviewed with him. And he said to me, he looked at me and says, I want to take you as a medical student. I will take a lot of heat from the state because you are a foreign student, but don't make a fool of me and make me proud. I'm going to accept you. There's no way a medical school in the UK will do that. I'll take it to the next step. So I got accepted. I got it accepted in medical school. As a foreign student, during medical school, I got my residency and I got my citizenship and I became a citizen. And I did my training. I mean, Case Western Reserve back in the day was one of the top medical school for cardiology. I finished there and I came in here. I am competing with 88 cardiologists in town. None of them could do what I've been able to achieve in opening up a private practice. I don't think I could ever do that in the UK. For a foreign born, for somebody with a name like Fadhil Hussain, to open a private practice in the UK in Baker Street private and be successful and sustain it and compete with big healthcare system, there's no way you could do that in the UK.
So what you mean, doctor, is that the UK is more biased?
Absolutely more biased.
Yeah. So you can't
Okay.
get a job as easy as the US. But
Not
if you
job,
have,
you won't get the opportunity. I mean, you won't get the opportunity that I got when I was here at University of Connecticut. You know, there was a cardiologist who won a Nobel Prize in calcium channel regulation. His name was Katz. Dr.
Yeah.
Katz was a big scientist. He had the biggest lab. Okay, here is Fadhil Hussain with a lot of other applicants for his lab, to work in his lab, to do research in his lab. You know what? He chose me because I had better grades and I had better skills than them. But in the UK, they would have never have chosen me. He would have chosen somebody else. Katz is an American. He is Jewish American, and he accepted me because I had better skills and better record than the other applications. And there was 100 other applications for people to work in his lab. And in the US, if you are good at what you do, they could care less where you come from. In the US, if you're good, I mean, am I going to say it's 100% race free? No. حتى بالعراق إذا واحد عراقي إذا واحد يجيني واحد مصري واحد عراقي إحنا ناخذ العراقي قبل ما ناخذ المصري. There is some bias, but nothing like the UK. هنا بهالبلد, if you prove yourself you're worthy, doors will open up for you.
Okay, that's really interesting. So it doesn't really matter if you have a good CV or you have a lot of researches to your name or are you good at what you do. It doesn't matter at the UK, they're biased. That's why I get it from you.
If they have trouble understanding you, they'll prefer somebody who they could understand better. If they want to make fun of your, I went to school in the UK. They are a lot more racist than they are in the US.
Okay, thank you, doctor. And I have another question for you, if you don't mind.
Go ahead.
You've mentioned that research can improve your CV.
Yes.
In Iraq, we don't have a developed research course, or they don't teach us a lot about research. So my question is, do you know someone we could get in touch to who can be our mentor or help us do research?
Yeah, in Iraq, no, I don't. I mean,
we could do systematic review or meta-analysis. It's the research. If I do it abroad.
Yeah, I mean, I'll have to think who would be doing that. I mean, my son is a medical student here in the US, and he does the research. But I'm trying to see how could that be arranged. The problem is most of these people, they have applicants in front of them, and they choose from the applicant. And if the applicant is in another country, they're going to say, why am I gonna take the trouble of doing it? But let me ask. Your best bet, and that's why Noor mentioned the research, and I didn't mention it. If you are from Iraq, your best bet is to be able to come to the US for 2 to 3 months and do rotation in the US. Especially, this is a surgical association, especially for surgery. If you come to the US and you rotate with the surgeon, and they see that you're smart, and they see that you answer the question, and they see that your skills are good, they will take you. I mean, for an Iraqi, the best way to get in here is to rotate. We do a rotation here.
Yeah. Thank you, doctor.
No, you're very welcome. Okay, I take it there's no more questions.
Hello, Dr. Fadhil.
Yeah.
Aside from the great questions that have been asked, there are a few questions also written down in the chat that I'd like to read to you. They're also great. Someone asks, Shamsalam is asking whether it's one of the necessary and vital things we must have to, start our residency in the US. And she means the researches. You discussed about it being a bonus to add on to our CV, whether they were lenient with race or not. But her question is if it's necessary.
Is it absolutely necessary? No. It would help, but it is not absolutely necessary. What is necessary is what is absolutely necessary is a very good board score, and really necessary is to rotate with the hospitals that you're shooting for here in the United States. Now, don't wait too long after graduating before you apply. 5 years is an important cutoff. They will never accept anybody after 5 years from graduating. So three
Okay.
things: board score, rotation, and 5-year cutoff.
Oh, okay. Also another question here. Someone was asking if like what is the right pathway? You know, this is for people who want to take in the pathway of surgery right after USMLE. What is the right step for someone who wants to study surgery abroad?
So the right step is before you finish your 4th year, you approach your college and your medical school, whichever medical school you're in. You approach them, you ask them to do some rotations abroad. And the rotations abroad are I'm assuming the US. So you come to the US and you plan that ahead of time. Plan that a year ahead of time, 2 years ahead of time. So your visa is in place, your place in the rotation is in place, everything is in place. So it's taken care of. You shouldn't wait on that and be lackadaisical. The second thing is you really need to get a high board score. If you do the rotation, if you do a rotation here, 2 or 3 months rotation with a surgical program, and they are good, they will take you. So you plan that ahead of time. You plan on taking the board exam, and you'll be all right.
Okay, and one last question. It was when you were earlier mentioning the hospitals in Detroit and across the states, they were asking whether you can write them down for the students.
I'm sorry, write the name of the universities or what name of what?
Yeah, the hospitals and the that we can shadow and the universities as well, the ones you mentioned earlier in the webinar.
Oh, okay. Noor, I'm gonna ask you for your help. Are you there, Noor?
Yeah, sure.
Okay. So Noor, if do I need to write all of them now, or should I give it to Noor and Noor will post it to you guys?
It's fine. She can write it down, you know, just and send it in. We can post it
Okay.
whenever.
Noor, so Noor, some of the hospitals that are welcoming to Iraqis and foreign medical graduates, and especially Iraqis, are Henry Ford in Detroit, Beaumont in Detroit, Detroit. I'm trying to. The name of the university, the name of the hospital is the Downtown Detroit Hospital. I can't remember its name right now.
You can just send me the list after the presentation and I'll get it to the organization. They can post it.
No problem.
If that's okay with you guys.
That's
No,
fine.
of course, fine. No pressure, you know, whenever you would like to.
Sure.
Yeah, I just want to make sure you guys get the right information. But yeah, I'll make sure to get that to you.
Thank you. And doctor, for our final question, it was my personal question, and there has been a lot of things I've heard in the US about, you know, the economic instability. Some of my friends said that they had to take a year off of med school in order to support themselves. And I wanted to ask how that issue would turn out with us foreigners.
If you live within your means, you'll be okay. I mean, you can't buy an expensive car, you can't live in an expensive apartment. If the thing to do is to choose. I mean, here's the biggest mistake that Iraqis will do. They will insist on working in Washington or Boston or New York. The apartment, a studio apartment, a one-room apartment in these cities are $3,000.
Very expensive.
Okay, so if they're willing to come and to Detroit or Cleveland or Columbus or Cincinnati or Toledo, Ohio, the apartment is $1,000, $800. If you instead of living by yourself in an apartment, you take a roommate. So you rent a 2-bedroom apartment for $1,500 and you only pay $750. you know, Iraqis, we tend to go for the biggest and the best and the most expensive. And during residency, you can't afford to do that. Yeah, you know what? You want to avoid the big city. You want to avoid New York, Washington, Boston, Chicago, and you want to go to good programs in cheaper cities. And there are good programs in cheaper cities. The Mayo Clinic is one of the best programs in the country. It's very well known, and it's in the middle of nowhere, and the rent is dirt cheap. So you
Yeah.
could, yeah. So you could do it. All you have to do is just make sure that you don't live it up.
Yeah, there are definitely some cheaper ones. The state I was personally in was known to be cheap. If you've heard of Arkansas, it's
Yep.
more in the south part.
Yep.
People move from New York to Arkansas for the sake of it being a lot cheaper.
Exactly. Arkansas, you probably get a studio apartment for $400 a month.
Yeah, it's pretty.
And
It's
that-
very, it's good for budget.
And by the way, a state like Arkansas wants to have residents come to their places, so their salary for residents is even higher. So here's the thing: a Harvard residency program will pay you less because everybody wants to go to Harvard. So
Yeah.
they pay you less in the most expensive city. Arkansas will pay you a ton more in a cheaper place. So you got to balance this out a little bit, balance it out, and you should be okay.
Okay. Is it okay if we take a few more questions that were written in the chat?
Sure.
Someone was asking about if it's necessary to have a good medical school record, or is the CV more important? As you mentioned earlier, when you were
So-
going abroad, they said that
Yeah.
we could not, overlook how good your scores are, how
So
despite being a foreigner. So
here's the thing. In the old days, when I first came here and I went into medical school, University of Baghdad had a very, very good reputation here. If you graduated from University of Baghdad and you applied to a residency in here, they would say, "Oh my God, that's a good university. There's a good education." They will take you right away. Unfortunately, the Iraqi medical school's reputation has deteriorated a little bit in here, and there are some people, in general, Iraq has taken a few steps backward as far as reputation of a medical school. Now, the way to prove to them that, so what has become more important is your score, your board score, more so than your grades in medical school. They still want to see the grades. They still want to see things, but they want to see the board score. And I'll tell you why. Unfortunately, and I'm not going to blame all Iraqis, there are a few bad apples who have manufactured and had fake medical school records. So they were terrible students and they show all A's, and they apply and they get in, and the residency program says, "You're terrible. What is this? What's going on?" So they rely less and less on medical school records and more on board exams.
maybe they are, behind the rumors about the U.S. not wanting to take in any more students from Iraq, maybe about how the U.S. MLA will not be given anymore. Maybe they are behind these rumors.
No. So here's the thing. Why do they prefer, if there's a preference to people who graduate from here, it's because the people who graduate from here are more familiar with the system. So the residency program doesn't have to teach the medical student that graduate from Toledo or the medical student that graduate from Ohio State, because they already know the system. But if somebody comes from Syria, Iraq, Iran, Turkey, Saudi Arabia, and the residency program is going to say, I have to teach them the system, which takes me to the earlier statement I made. If you do a rotation here and you do well, The residency program says, you know what? I don't have to teach him the system. They already taught the system. They already spent 3 months in here. They already know what's going on. So if there's a bias, it's not against Iraq per se. It's a bias against somebody who doesn't know the system, whether you come from Iraq or Germany.
Thank you very much for that thorough answer. Just one more student has their hand raised. They've had it raised for a while.
Go ahead.
So you can go and ask.
Okay, hello everybody. My name is Murtada Abdul Hamid. I'm a fifth year medical school at Mustansariya University. I have a plan inside my mind about how to get out of Iraq and go to America. Right now, I'm focusing on what I'm taking in medical school in Mustansariya. And this I'm deciding to take the first year after being graduated, studying for USMLE Step 1. After that, I will take Iqamat Dawriya in Iraq and take a visa and travel to America, where my uncle is there. My uncle is Ali Abdul Hamid. He is the father of Noor.
Okay.
Yes, he invited me to. He said, "Come to America. I have a home there, and you can use that to being a doctor there." So my question is, can I do a residency in both Iraq and then after in America? And what's the pathway to do that, the right pathway?
I strongly suggest you don't waste time between graduating from medical school and applying to residency program. They have become very strict. The longer you are out of medical school and not into their residency, the less likely they will take you. So if you're going to take the compulsory study for the board while you're doing the compulsory 1 year in Iraq, don't wait too long. If they look at your application and it's been 3 years since you graduated, they will not take it nicely. They will not. They're going to say, what have you done in the last 3 years? You could tell them I did a compulsory year and this and that. They're going to say, have you done any residency? Have you done any program? If you tell them I sat for a year to study, they're not going to look at that kindly. They're not. You'll have to tell them I did a rotations for a year. I did a transitional year with this hospital, or a transitional year with this hospital while I was studying for the board. They will accept that. But what residency program, and I was part of the residency committees program. When they see somebody who doesn't do anything related to medicine, but studying for the board, that's a red flag for them.
Okay.
So my suggestion would be is to get here if you're able to come here, to get here as quickly as possible. And while you're studying for the board, and that's what Mustafa al-Baldawi did, and I helped him. So while he was studying for the board, we made sure he stayed in the hospital, doing rotations in the hospital, shadowing 1 month after another. So he shadowed me for a month, then he shadowed a vascular surgeon for a month, then he shadowed an interventional radiologist for a month. We made sure he was in the system 1 month after another while he's studying. So when the application came to the residency program, so what are you doing? Well, I finished this, and while I'm studying, I'm doing this and this and this. If they see a gap where you're not doing anything, that's a big red flag.
Okay, doctor. So you're suggesting me not having a gap year?
I would not. A gap year, if you're going to take a gap year, make sure that you're doing something clinically during the gap year.
Okay.
So an empty gap year is not good. A gap year to study, yes, study it and do things in the hospital. Come to Seattle with your uncle and have him go to and have him hook you up with people you could shadow. So they don't have to pay you, but you're shadowing, you're into the system. So when your application says, what did you do last year? Well, I did a month of rotation, this, I shadowed this, I shadowed this, I shadowed that, while I'm studying for the board and I took the board exam. That is so much better. That's a ton better than I took a gap year to study.
Okay, so can I, after getting graduated, have a residency in the US? And before that, I didn't have any residency in Iraq because I heard that you can apply to any hospital outside, abroad Iraq, if you didn't done any residency in Iraq.
I don't know about
Is that
that. If you, all they want you to do is do your medical school and your board. That's all they want.
okay? So I can have
Your uncle would
residency.
know more about that than I would because he's a graduate from Baghdad. But all I know for Mustafa, he did half a year and he came here and he shadowed us for the other half.
Okay,
But ask your
thank you.
uncle. I really don't think they insist on having a residency program there.
So I can
Yeah,
I can have a
sorry.
residency out there when I
What you do,
didn't have anything.
they're not gonna take you into a residency program unless you pass the board and you get accepted to the residency program. But you could shadow while you're studying for the board in these programs. One, to prove to them that you're good. Two, to get familiar with the system, so they will say, "Oh, well, we don't have to teach him the system. We don't have to teach him how it works," and they'll take you easily.
Sorry, what do you mean by shadowing?
So in the United States during medical school, the fourth year, the last year in the medical school, you do clinical rotation. You do a month of surgery. You do a month of acute abdomen. You do a month of infectious disease. You do a month of gastrointestinal. You could do that here, but without being accepted as part of the medical school. So you are a shadow. You do that month of shadowing of working with the gastroenterologists, with the surgeons, they call them shadow instead of actually being part of the rotation.
And anyone can do that?
Not anyone. The program has to accept you because the program has to be willing to take you. Yes.
Okay.
How do we apply for these programs?
What you do is you contact the program directors, the office of the program directors. Most of the time it's somebody who knows somebody, but you contact them. You say, I'm in the US. I'm a graduate of this university, and I would like to shadow this doctor, this doctor, this doctor, or I'd like to shadow this rotation. They will tell you. They will ask you for recommendation letters. They will ask you for an application to fill. Now, hopefully, you know somebody in the program that will give you the recommendation letter, and that's what we did. For example, for Mustafa, I frequently get people asking me to write out recommendation letters for medical school or for residency programs, and the way I build the way I know that they are good or bad is if they shadow me, if they are with me, if they do 2 or 3 weeks where they shadow me all the time, they are with me all the time.
I just want to add something about shadowing. So basically, you would want to get a rotation or a shadowing opportunity at the program that you'd see yourself at, because that shadowing, that 2 to 3 weeks, is basically an interview. They're seeing how you interact with patients, how you are professional, how you communicate. You know, they see your skills, right? They might let you take histories, present patients, cases, and things like that. So that opportunity, you're not like actually practicing medicine. It's just seeing, like, looking at the doctor, seeing what they do, making sure you talk to them, and just they see who you are as a person. And then because of that, you're going to get a letter of recommendation, and then you can get an interview for the actual residency program. But that shadowing opportunity is way more important than any research, in my opinion.
I agree, and that's why research in Iraq, somebody graduating from Iraq, I don't put a lot of weight on research, because the research, unfortunately, is not as advanced as in here, and people don't look at it and they don't know how accurate it is. But shadowing, high score, and you don't wait too long after graduating.
By programs, do you mean hospitals?
Yep. Hospitals that have residency program, they have teaching programs, that have medical schools.
Thank you.
Doctor,
You're welcome.
Doctor, can I shadow at time? Can I shadow, as long as I want?
No, so you're not the only, you will not be the only students who wants to shadow. So most programs, for every rotation, they don't take, so if it's a small hospital, they will take one person a month. So it's not fair to have one person take all the shadowing while other people want to get into it. So each hospital will give you maybe 1 or 2 opportunities to shadow. So they will give you an opportunity to shadow in GI. They will give you an opportunity to shadow cardiology. They will give you an opportunity to shadow surgery. But you can't stay in the same place shadowing the same person for the whole year.
Okay, got it. Thank you.
You're welcome.
Doctor, some students are wondering how they could, get in contact with Dr. Mustafa Al-Baldawi, if that's possible.
Well, I'll tell you what, I'll text him, and if he's willing to be contacted, I'll tell Noor to post his emails for you.
Okay, you get back to us whenever you'd like.
No problem.
For the questions, that covers the majority of them. And before, leaving, we just wanted to thank you very much for being here, for giving us a very informative and very deep lecture on your experiences, on what benefits us. We're at a stage of our life where we have minor information about studying abroad. So we really thank you, and we really appreciate it.
I really hope it was helpful. I don't know. You guys let me know.
It was very helpful.
It was extremely helpful. Thank you so much.
You're very welcome. Anytime. So Noor is gonna put my email, and if you guys need anything, just email me.
Okay, we will do so. Thank you again.
You're welcome. مع السلامة. الله يحفظكم. مع السلامة.
Goodbye.
Bye-bye.
Regarding the information on the hospitals and where are we going to receive the information? Who's going to be sending it? Or to what groups?
I'll send it to Shams. I'll send it to her. Like Dr. Hussain will send me the list of the hospitals. So I'll get that over to you guys. And then his email is also in the chat as well. So let me know if you guys have any questions. But thank you for having us.
Is it going to be like on thank you so much. Is it going to be like on a Telegram group or like the same Instagram account that runs the actual like meetings?
I'm not sure. Maybe ask Shams what she'd like to do with that, but I'll get that information to the president and they can deal with that.
Thank you.
Appreciate it. Thank you.
Thank you.